I wish to welcome you to this important forum on tobacco taxation in Kenya. We gather here today united by a common goal, which is to enhance public health and generate sustainable revenue through effective tax policies. Tobacco taxation is crucial not only as a public health measure, but also as a vital tool for revenue generation. In alignment with global and local practices, Kenya is committed to adopting excise tax policies on tobacco that reflect international standards, particularly those that are recommended by the World Health Organization. Ladies and gentlemen, the World Health Organization has consistently advocated for tobacco taxation as an effective strategy to reduce consumption and prevent tobacco-related diseases. According to the World Health Organization's framework Convention on Tobacco Control, raising taxes on tobacco products is one of the most impactful ways to lower smoking rates, especially among young people and low-income groups. In Kenya, our taxation framework supports this initiative by progressively increasing excise taxes on tobacco products, making them less affordable in accordance with the World Health Organization recommendations. Currently, the total tax on tobacco levied by the Kenya Revenue Authority as a percentage of retail price stands at 46.12%, and that if you compare that with the recommendation by the World Health Organization, which should be at least 75%, we still have got a long way to go, but like my colleague said earlier on in her remarks, Pamela, this is being done progressively every year. To combat tobacco affordability, we recognize the need for regular tax increases that outpace inflation and income growth. Through the excise duty amendment bill, Kenya is making significant steps to ensure that the real price of tobacco products aligns with the World Health Organization guidelines, thus promoting public health. Our taxation framework in KRA comprises of three main taxes, which include, number one, the excise duty, where we apply specific excise duties based on the type and harm level of tobacco products, with higher rates for cigarettes, the most widely consumed form. And the second one is the VAT, value added tax, which has a standard VAT of 16%, which is imposed on all tobacco products. The third, ladies and gentlemen, is the import duty, which ranges from between 25 to 35%. And this is applied to tobacco products classified as sensitive items. While products from the East African community are exempt from import duties, they still remain subject to a 2.25% import declaration fee. This multifaceted taxation strategy is designed to discourage tobacco use across product categories, from cigarettes to novel nicotine and electronic devices. It is also important to understand that in Kenya, all manufacturers and importers of tobacco products must be licensed, and we do this very closely with the Ministry of Health. This requirement ensures compliance with tax regulations, facilitates monitoring, and helps prevent illicit trade. And the Kenya Revenue Authority plays a very pivotal role in this process, together, of course, with our multi-agency partners in government. Under the KRA's enforcement division, which is the one that I head, KRA is dedicated to ensuring compliance through rigorous licensing, inspections, and monitoring. Our intelligence-driven enforcement aims to combat illicit trade in tobacco products, which is an essential focus as highlighted by the World Health Organization. To further strengthen our approach at the Kenya Revenue Authority, we have adopted technology, and in particular, a system that we call the Accessible Goods Management System, EGMS. This innovative system tracks accessible goods, ensuring, and among them tobacco products, of course, ensuring that they are taxed appropriately while preventing diversion into illegal markets. This system, called EGMS, ensures that accessible goods like tobacco products are monitored across the supply chain from production to retail. It has high security excise stamps and scan codes, which we can verify product authenticity, we combat counterfeiting, and ensure compliance with taxation regulations. As we move forward, ladies and gentlemen, collaboration among all stakeholders is very important and crucial. Together, we can transform tobacco taxation into an effective revenue-generating initiative, while at the same time enhancing public health. I urge all manufacturers and importers to adhere to excise laws and support initiatives aligned with the World Health Organization's global tobacco control efforts. Regional harmonization will also play a key role in preventing smuggling and ensuring the success of our tax policies. In closing, ladies and gentlemen, I reaffirm my organization, KRA's commitment to adopting World Health Organization recommendations and working collaboratively with all stakeholders to create a robust taxation and regulatory framework for tobacco products. Thank you for your attention, and let us work together to make a healthier, tobacco-free future for our country. Thank you very much.